beginning of this video, you saw a picture of some stairs in Thailand, in Chiang Mai, and I used to go up those stairs every morning, 4 or 5 at a time, because they're quite little stairs, because I guess the Thais are littler than we are. But anyway, one day I went up those stairs, came down, and I was walking on the street, and my knee just went out. Boy, when I say went out, I took a step, and the next step was, ouch, so much pain. Whew, you couldn't believe it. So I had to call somebody to take me home to the hotel, and at that point I had the big fear of spending the rest of my life in a wheelchair, because when you're old and not ambulatory, you're at the mercy of somebody else who has to push you around, and that is something I sure didn't want to be. Okay, so I spent a little time holding on to a couple people, walking around, but every step was painful. So I went back to Switzerland. Even sitting in the plane with every time I would bend my knee or try to get up to go to the bathroom, very painful. Now, when I got to Switzerland, we started to look for a doctor, and it was recommended we have a sports doctor. So we looked around for the best doctor we could find, and you know, when you're in bad shape, cost is not your main concern. So that if I could just walk normally again, I really didn't care what it cost. So we sought out a guy, and we're warned that he is pretty expensive. But I went for an exam, and he says, "Oh, Grandpa, you got osteoarthritis." He knew that right away. He just felt the knee and gave me that diagnosis right away. And I said, "Well, doctor, is there any cure for that?" And he says, "Well, you know, different people are all different, and different people respond to different treatments. So we can try a few things and see what works." Okay, well, that seems reasonable. And the first thing he says to me is, "You know what? You're a little bit too fat. How much do you weigh?" About 95 kilos. Now, if you're watching this and you want to know what that is in pounds, I think it's, 2.1 or something? Whatever, something like a little bit more than 2 pounds. So maybe that's about 225 pounds for your Americans. But anyway, it was 95 kilos. So he said, "You know what, Grandpa? If you got down to about 75, I'll bet your knee problem would go away." Now, the funny thing is, just before I made this exciting video that you're going to see now, I went to the internet, and they had all kinds of cures for knees, and not one of them mentioned losing weight. A little bit crazy, huh? Well, to make a long story short, I said, "Look, doctor, I can't walk at all, and can you give me something or do something so that I can just, be able to walk around without pain?" He says, "Yeah, we'll try something. We'll try a cortisone shot. And he said, the problem with cortisone is if I give you a lot of them, many of them, it will actually reduce your cartilage even more than it's reduced. And the fact right now is that your situation," I forgot to mention, he sent me for an x-ray, and he noticed that my cartilage was almost gone. So he says that whatever is left, if I was to give you a lot of injections, it would get even worse. And not only that, cortisone repeated injections can make you crazy. Oh, what do you mean crazy? Crazy what? He said, well, you get delusions and schizophrenia and you're not a normal guy anymore. I said, well, maybe I should forget that cortisone. He says, no, one won't hurt you. So let's try that and see what works. Well, I hate needles. Boy, I would be a terrible drug addict because just the sight of a needle makes me very, well, I almost faint. Okay, so here we go, and he does something, and I just turn my head to the wall. I don't want to see any needles. So he says, you don't want to look? I said, no, man, that's the last entertainment I need today is to look at your big needle. Wow. Later on, I'm going to give you an Academy Award scary part of this video to show you how somebody with a needle can scare the living daylights out of you. Well, anyway, getting back to my story. He gives me a shot and says, you just sit there in the waiting room and then come back and we'll discuss things. So I have the shot and the knee is just as painful as ever. Oh, but the shot wasn't bad at all. I just didn't look. Apparently these days they put some kind of brown stuff on where they're going to give you a shot, and that's like an anesthetic that penetrates maybe a centimeter into your skin, and so when they give you a shot, you don't feel anything. It wasn't even a mosquito bite. So I want to tell you folks that if you're going to get a shot of cortisone, say, hey, I want a local anesthetic first so I don't feel anything. That is if you're like me, really scared of pain. Okay, so here we go. So I have this, I wait for about an hour, and I go back in to see the MD, and he says, okay, I don't know how this cortisone injection will work for you, but one won't make you crazy. Won't even have any mental effects at all. But the first thing I'm going to recommend is that you go on a diet. And so, although I don't like diet and I like food very much, well, what I did was I read about this intermittent fasting. So I cut out breakfast, I cut out dinner, and I just tried to have a light lunch for 3 days. Very uncomfortable. But after a week, guess what? I went from 95 kilos to 83, where I've been for the last 10 years, 83. I'd like to get down to 75, but 83 seems to be my plateau. Okay, so getting back to my discussion with the MD, and this is important for all of you. Well, here I got notes. Here is the cure. Ta-da! So cortisone doesn't work for everybody. And then the next thing is going to be plasma-rich replacement. And I'm going to tell you about both of those first. Okay, so the cortisone is basically a temporary pain relief and inflammation reduction treatment that sometimes works and sometimes doesn't. Well, it was really good news for me because after I finished this discussion with the doctor, it was a miracle. It was like I could walk. I didn't feel the littlest bit of pain. It was terrific. Now, let me warn you, it doesn't work for everyone. It works for about half the people who get it, the shot. It's just a miracle. You're back to normal. Now, the MD said if you don't want these treatments, we got something that might work for you, and that was that plasma replacement. He says, so if you feel your cortisone wearing off, or even if you don't, come back in 2 weeks and we'll give you a plasma replacement. Well, what's that? So here's how it works. You get a needle in your arm again. Well, I'm not going to talk about that because I hate needles. But you get they take some blood and then they put it in a centrifuge. And then it separates the red part from what's left is like a syrup, brown. And they re-inject that syrup in your knee. And apparently for 50% of the people that works. But when I did, the cortisone lasted 2 weeks. I was like normal for 2 weeks. But I figured, okay, if I can't get another cortisone shot, if it's going to wear off on me, maybe I'll sit down here on a nice bench. Okay, I had a nice rest, and I'm going to go back over the story a little bit. Okay, so I got this cortisone injection, and within an hour, it was like a miracle. I was able to walk normally, no pain. I go into the MD, and he says, well, I recommend that you don't have a lot of cortisone shots because it could make you a little bit nuts. Okay, getting back to what happened next. He said if the cortisone starts to wear off, we have another treatment we can try and see how that works. That may be less temporary. The cortisone is temporary, but this one is called plasma replacement. So they take a blood from your arm, put it in the machine, and you get out a brown liquid that they re-inject in your knee. So we did that 2 weeks later, and that wasn't as good as the cortisone, but at least I could walk with minimum pain. So the next thing is the doctor sat down and said, well, look, we'll try a lot of different things, but I want to tell you that there's radical things that can be done. One of them would be stem cell injection, and the other would be a knee replacement with titanium knee. Okay, guess what? The titanium knee and the operation would cost about 50,000 euros or dollars. You know, I'm big on not spending that much, and especially since he says the knee is not guaranteed for your life. It may have to be taken out and put back in, so it's not any more permanent than it's more permanent than a cortisone injection, but not guaranteed. And then there's something called stem cell injection, and that goes big needle in your hip, and that usually works, but that's another 50,000 bucks. Well, I already told you this guy, this stem cell, this MD was a little bit expensive, and so my one cortisone injection was 500 euros or dollars, which, okay, it's worth it to be able to walk again, right? I think you agree on that. By the way, if you have any suggestions, put them in the comments. If you have your own story about how your knee pain was cured or made worse. All right, moving along. I was then prescribed a pill called Chondrosulf, and that particular pill, I'm going to show you the actual bottle and everything. It worked very well, and it's for 10 years now I've been taking that every day, and I noticed when I stopped for 3 or 4 days the pain came back. So Chondrosulf, thank you, that works very well. The pill itself is a little bit on the expensive side, so I recently found a generic substitute, which I'm going to show you in a few minutes, and I take that and alternate it with the Chondrosulf just to save a little money. So I think, let's see, ta-da! Okay, well, actually that's the most important thing, losing weight. And strangely enough, in all the other videos about me treatments. It's the one thing nobody seems to talk about. Maybe there's other videos that I didn't see, but I lost weight, and when I started to put it back on again, I went from 85 to 90. Guess what? The knee pain came back. So this is not going to be one of my funny videos unless I can think of something funny to do next. But that might be useful to you. And as I said in the beginning, different cures work for different people. And cortisone and a daily pill worked for me, and I'm normal after 5 years. So that's it for now, and we'll turn around here so you can see this beautiful building again. There you go. Okay, now here comes a scene worthy of an Ed Wood horror movie. It's going to be an evil doctor about to give me a shot in the knee. Oh God, I shouldn't have done that. This is the thing I use to fill my my computer ink. Well, anyway, here we go with the next horror scene. No, don't give me an injection. No, stop. Okay, now should we get for real again? All right, for real. The thing I didn't mention was the fact that you're supposed to give yourself a massage around the knee with this product called castor oil. And so you put a few drops on the top and on the bottom, massage it in a circle, and that is supposed to help with whatever it is, I guess giving your cartilage a little bit of moisture. Now, I was a little bit skeptical as to whether this worked, but I have a touch of arthritis in this finger. So I put a little of that castor oil on it. Guess what? It cured it. So if you have a little arthritis anywhere, get some castor oil. One of my anti-vax pals said, "Oh, that castor oil will kill you. It's ricin. Ricin is a formidable poison." I said, "Look, the vax didn't kill me. I got one of those for the COVID a few years ago." He said, "I'll be dead in 6 months." Well, that was about 6 years ago. I'm not dead. Okay, so anyway, I did the ricin. It worked fine. Now, the next thing was what I take every single day for all these years. It's called chondrosulf. Here we go. I want you to really be able to read it. But that works out at about $1 a pill, which is pretty expensive for me. So I found a generic substitute. Here's that. And I alternate. I take one of these and one chondrosulf. And when I stop for a few days, guess what? The pain comes back. So I know that's really working. So here is the basic thing. A shot of
hyaluronic.
A shot of cortisone, followed by experimental shot of hyaluronic acid, which didn't work, and another experimental shot of plasma, which didn't work, but in combination with the pill and the castor oil, it worked. I'm walking, and maybe you'll have the good luck that one of these experimental methods will work on you as well. So Merry Christmas, Happy New Year 2024, and hasta luego.